They have a really strong power to pull the information that they're supposed to get, but more importantly, suppress all of the other information. And so when we have conversations about epigenetics, which are sort of this signaling around our DNA that allows the expression or suppression of information, the majority of the job of the epigenome is suppression. And it's when you lose your ability to suppress that information that some aberrant activity starts to occur inside that cell.
Welcome to the Neuro Collective Podcast. I'm your host, Dr. May Bagnell, and with my wife, May Bagnell, we are excited to have you join us as we explore the transformative world of functional neurology, mindset coaching, and functional medicine. Our mission is to provide valuable insights and practical solutions for those who are passionate about neuroscience, alternative health, and holistic wellness.
Hey everyone, welcome back to the Neuro Collective Podcast. We are here on video. You've been used to hearing us on audio, and we have an upgrade. And today we have a very special guest, but before we even introduce him, I want to introduce my co-host, Dr. May Bagnell, and take it away, Doc.
All right, so we are here on a very special edition, like you said. It's really our second video interview, but really, this is really where we're getting into some of the more beautiful things about brain health, neuroscience, and from a perspective that I love, that I've learned from this man, Dr. Jason Saunders. Good morning.
Good morning, Doc. Happy to be here. Love it.
Good. I mean, I'm super excited. We are super excited because I heard you say something some years ago, and this is what it was, and it totally captured me, and I've repeated it numerous times to people in our practice and other doctors, and that is oxygen is the essential nutrient. I love that you said that. So Dr. Jason Saunders has really brought us into the world and educated us on hyperbaric oxygen therapy. And so I want him to give you, before we get into that, which is really the topic of this, and his journey into healthcare. And then I'm going to ask him a few other questions. So Doc, tell us, how did you even arrive in healthcare?
So, I mean, as a kid, school was not my forte, even to this date, my mom would say something like, I couldn't even get you to read a book and now you've written 4,
Wow.
Love that.
And so, I guess I never really found the thing that clicked, my freshman year of college, I took an anatomy class just on a whim. And I was like, oh my God, that's how the body works. If I wasn't in healthcare, I would be working on cars or motorcycles or boats. Like I always of like, I have a very mechanical mind, I guess. And that's kind of what I thought I was going to do, is have like an auto shop and repair cars. And when I took that anatomy class, I was like, oh my God, this is like auto mechanics of the human. And humans actually heal themselves. Cars need people to fix them. I was like, it's so much easier to be a doctor than a mechanic. I think I should go in this direction.
So cool. Love that.
Yeah.
That started that journey. I also had a pretty bad neck herniation, a disc herniation in my neck at a pretty similar time in my life. And I had gone to a bunch of surgeons and, neurosurgeons, and everyone's like, drugs and surgery. My mom is super conservative that way. And she was like, just doesn't seem right. You're so young. I don't know if you really need this. Somebody said, you should go see a chiropractor. And I was like, I'm going to see all these top neurosurgeons and they have nothing to offer me. What is a chiropractor going to possibly do? And after a few months, I finally literally grudgingly went, and within 3 weeks it was got like all my issues were gone. And I was like, oh my God. So it was kind of a culmination of those two pieces coming together within about a 8 or 9 month period of time in my life, where I was like, that's clearly the direction. So that was really what got me started in
that's health. It. And then how did you go from that? I know we're covering really the highlights for me. How did you get into hyperbaric oxygen therapy?
So fortunately or unfortunately, another herniated disc early in my practice. So I was only in practice probably maybe just a little over a year. And my wife and I had bought a house, and we weren't working in that house at the time. We were just going to renovate it, flip it, and kind of, move from there. And so we were renovating the house. This is back now in 2007. And so in the midst of this 2007 renovation, two things happened. One, the housing market crashes. So we're like, probably not flipping this house.
Yep.
And two, I was doing most of the work myself. So I was putting a roof on the house, and it was like December, cold in New Jersey. I was throwing shingles down on the roof, and I herniated a disc in my lower back.
Wow.
Long story short, the disc, the back issues were pretty well under control. As you know, Melissa's a chiropractor as well. So, she's treating me at home. My background before that was nutrition and exercise. So I'm doing my rehab. I'm keeping things, inflammation low. I'm eating all the right foods. So my back issues get better pretty quickly, but I was left with right foot foot drop on my right leg.
Mm.
So basically nerve damage that continued on my right side. And no matter what, I did acupuncture, I did some massage, I was looking for other things. I was actually at a chiropractic conference. They happened to have, hyperbaric chambers there to try. I had no intention that was actually going to help me. It just looked interesting and I wanted to experience it.
Sure.
And so after about a 20-minute session, I climb out, I start walking around the vendor hall, and I start getting pins and needles in my right foot, which was the first time I had felt my right foot in about a year and a half. And I was like,
Whoa.
whoa, am I feeling that because of that thing I don't even know what that thing was I just did. So I go back, I talk to the guy, and he says, oh, of course, it helps regenerate nerves. I'm like, yeah, says the salesman. Not buying it, but he agreed to do a handful of short sessions with me over the 4-day conference. And I left with about 10% recovery. And I was like, this is incredible. So I did buy one, brought it home, treated myself for, a couple months, and I had full recovery of that.
Wow.
Wow.
That was kind of that was the entry point. I had never, at that time, I still wasn't planning on using it in my office, treating patients with it. I certainly wasn't planning on doing the things that I'm doing now with regard to it. But it was, I had thought, as many of us do, we get out of school, we're in practice, to some extent, we feel pretty knowledgeable and confident with what we have to offer. And I'm like, how did I never hear at that time? I had never even heard the word hyperbaric oxygen. And through 2 disc herniations, no one ever mentioned it to me. Meanwhile, literally that, I had such a quick result. So that's kind of how I got interested in getting into the science behind that.
Yeah. And then the training and teaching, you've been all over the world. You've taught countless number of physicians and clinicians and therapists. We are some of those people that have been trained in understanding hyperbaric medicine for integrative healthcare practitioners, people in functional neurology. I mean, it was an amazing 4 days with you and your wife. And your wife's also a doctor, as you mentioned. Mm-hmm. So you have that team approach, just like we have our team approach. It's such a beautiful thing, though, to be able to work with your spouse, right? And she's an amazing lady, too. So now that you've been all over the world, you've been teaching about hyperbaric oxygen, you now move into a PhD work at the University of Miami here in South Florida. So tell us what prompted that next evolution in your life.
So, I was 41, I think, when I applied for the PhD program. I was already teaching hyperbarics. I had seen a gap in the industry where, it wasn't being utilized as much as I think that it needed to be based on how many people I know would benefit from it and how difficult it is for people to find access to it. And so I had started this, training and education program. But I really want to, as you could imagine, I get a tremendous amount of questions, through the teaching that I do, through the YouTube channel that we have. I'm fielding, hundreds of questions a week, quite honestly, about, hyperbaric and other with regard to, pretty complex, health concerns or really robust health goals for somebody who's really just trying to, improve performance.
Right.
And there's still such a gap in the research. And so I got sick of saying, I don't know. I hate, I'll say I don't know if legitimately I don't know. I mean, I'm happy to admit that I don't know, but I was so tired of not having certain answers to some of those questions that I said, these are all high level biological questions. Let me go get a PhD in molecular biology. By the time I finish that, I should have some answers to some of these questions. Plus, because of the research gap, I felt if I could contribute and
Right.
stop saying, not only do I not know, but here's here's some of the research that I was able to do to move the needle forward. And so, it took about just under 4 years. I just graduated literally a few months ago in May.
I
Yeah.
know.
And
Congrats.
thank
Congratulations.
you. And so, now I'm just working on getting some of those papers. I got one of them published so far, but I probably have another 3 or 4 papers that I could publish from that research that I
From
had
that.
done. But it was an incredible journey. I mean, it was very different, as you can imagine, going back to school at that level,
Oh,
20
yeah.
years after I've graduated, anything else I've done in like that academic world, as you are, and I am, like, always out there learning. And, it wasn't like
Yes.
I don't study, I don't take other courses, but, that traditional academic model is certainly a little bit more, I don't know if robust or really like
Definitely
specific.
more rigorous.
Yeah,
Yeah.
exactly. So, but it was
Yeah.
great. I mean, it didn't answer all my questions, but it answered a lot of them. And, here we are.
And so, you've kind of closed some of the gap on the research. I heard some of that presentation at one of the neuroscience symposiums that you spoke at just a few months ago, which was
Mhm.
amazing. And we know that hyperbaric is being used all around the world. We know that it's being used for certain conditions in allopathic medicine in the United States, right? In hospital settings and so forth. And it's expanding into private clinics because of your work and others, like Joe and others. So we have a chamber in our office. Talk about some of the indications that are being used off label, we'll say, just, topically here.
Yeah. I mean, here's what I would say. Even on label, I believe that we've gotten, and you could appreciate this as a chiropractor. It's like, you know, what are we actually treating, or what are we really delivering to a person, and is that the treatment, or is that just the, let's say, the obstacle or the hurdle from the body being able to heal itself? And so,
Yeah, good.
I view hyperbaric in that same light, in that there's a number of issues that, with a little bit more oxygen, could be very meaningful from a healing and recovery standpoint. Not so
Mhm.
Mm,
much that it's like the direct treatment for this particular issue or that
right,
particular issue.
right.
So even on label, if you really looked at, I mean, these are very severe and acute, like it's you're about to die, or you're about to have a limb removed, or you're about to lose your hearing or your eyesight. These are the kinds of things that hyperbaric is used for in
Right.
the traditional model. I bring that up just to say that if you categorized even the on-label stuff, you would see that it's tissue repair and tissue regeneration. You
Hmm.
would see that it's hyperoxygenation for something that's hypoxic, or
Right.
or moving in that direction, or in some cases even necrotic, like dying tissue. Um, and then you would see that it's basically immune compromised or some sort of
Mm,
infection issue. And
right.
so as you start to understand, well, okay, if on label in a hospital in very severe conditions, categorically, here's what we're using hyperbaric for. And we can understand that hyperbaric is a pretty big range of, some from mild pressure to high pressure, from breathing air only to breathing 100% oxygen. And there are a
Right.
lot of variations in between those two
Yeah.
extremes. And so, but if it works for this infection, why would it not work for this infection? If it
Mhm.
works to repair tissues at this level of damage, why wouldn't it help repairing tissues at some lesser degree of damage?
Yeah.
Exactly.
And so even as I teach this stuff, let's say for burns, the category for burns in a hospital is you need to have 20% of your body or full body burned, or it has to be in very delicate and sensitive, like hands, feet, perineum, like very delicate, very sensitive. But that doesn't mean that hyperbaric only works in those cases. That what that
Sure.
means is insurance may only cover it with those
Right.
particular criteria. But
Right.
tissue repair is tissue repair. The ingredients for tissue repair, they don't know, was it 19% of your body or 20 or 30 or 5? As you initiate a healing response, the body does, exactly what the body was designed to do, and tissue repair and regeneration are possible. And oxygen is just, as you started the conversation earlier, is one of the
Yeah.
most important components of that nourishment that the body, the cells need to upregulate the repair and regeneration. So
That's
to
right.
quickly answer, everything from a variety of different autoimmune conditions, primarily because of its way of reducing inflammation and
Mhm.
improving tissue repair and balancing the immune system. A
Good.
host of neurological conditions like MS, CP, post-stroke, even dementia. Again, because of how important oxygen is in, as you well
Right.
know, for our nervous system. Nervous system is, one of the most, if not the most, highly metabolic tissues, requires some of the most amount of oxygen that we can get. And so,
Right.
delivering that excess oxygen can really help improve neuron function. And then again, on infection, because of the role that oxygen plays in improving our ability to fight infection. So even off label, similar category, but typically more chronic and less severe, but still, from a quality of life standpoint, could be catastrophic.
Yeah, when you're mentioning that tissue repair and the anti-inflammatory process that's going on when you're subjecting it to this, I'm thinking of something where there's not tissue damage, quote unquote. A lot of the children that are on the spectrum that we work with, kids that are with ADHD, kids that are neurodiverse, their brain is working a bit differently and it's limiting them functionally. And we get them in the chamber with their parent, many of those smaller children. And children that have even had hypoxic brain injuries. So there's this massive amount of the population that could benefit, as you're saying. And in particular, what kind of experience do you have? No, I know you have experience, but what would you speak to if someone has a child that's on the spectrum, wherever they might be on that, whether they're in the beginning of their journey finding out, whether they already are working with their child in many different things in functional neurology? What would you say about hyperbaric oxygen for them?
Yeah. So again, one being that the brain requires, right? The brain, it makes up about 2% of our body mass, uses
Mhm.
somewhere around 20 to 24% of all the oxygen that we breathe in. And
Good
so it's a
point.
very small organ, but it's using up, or it requires a tremendous amount of oxygen just to do
Right.
normal function, like to have this conversation, let alone to repair, to regenerate, to reduce inflammation, to remove toxicity, a lot of the components that come with some of these challenges in these kids. When I first got into hyperbaric, my wife actually was more of a pediatric side. Like she did a lot of prenatal, postpartum,
Okay.
and pediatrics. So we saw kids in our office regularly. We didn't really see a lot of kids on the spectrum at the time. I think as our services expanded, we started to see more and more. And so during the early days of hyperbaric, we were seeing maybe a few a year, but not that
Hmm.
many. We also became really close friends with another doc in New Jersey at the time. He's since retired, but he had an autism only practice. And
Mm.
I mean, he was treating hundreds and hundreds of kids on the spectrum, and hyperbaric was a main part of his protocol. And
Wow.
so as he started to want to wind things down and retire, we had conversations, and he said, listen, I need you to follow my programming, but would you mind if I sent these children to you? And we also happened to hire one of his technicians at that time who,
Mm.
she has treated more kids on the spectrum with hyperbaric than anyone on planet Earth, probably.
Hmm.
And so we've treated ourselves, hundreds and hundreds of kids at this point. Her thousands. She's been doing it for 24 years,
Wow.
Wow.
and autism only, essentially. So we've had the opportunity to see a number, obviously a large range of these children, and everything from learning delays to just other developmental delays through the autism spectrum and even
Right.
CP. uh, to as you well know, anything that you can do earlier and earlier into somebody's issues. So when you have a
Yeah.
kid, kids are going to respond generally much faster than adults, and their brain is rapidly developing. Right, they're going through
Yes.
all their um, neural pruning and rewiring, even just through normal developmental pathways. When you get a chance to upregulate that system and really help that child heal in those early years, I mean, I could tell, I mean, story upon story upon story, but
Wow. Yeah.
incredible changes for these kids inside of our office. It's one of the few things, like, you can get numb, even as a chiropractor. You're like, I treat this kind of issue all the time. Like, you almost expect it to get better, and you're more
Yeah.
surprised when it doesn't,
Right.
And
That's true.
hyperbaric is like similar. Like, you'll just see so many people responding that you're like, you just start to expect that they're going to get better. But when
Yeah.
you see a kid a nonverbal child speak their first words, tell their mother that they love them for the first time getting out of a chamber. Like,
Wow.
you never get numb to that. Like,
Mhm.
and we seek things like that every week. It's
Wow.
really incredible.
Very powerful. Very powerful. Well, my co-host, I know you wanted to talk to Doc about longevity, anti-aging properties, things that have come through. Why don't
Yeah.
you launch that question to him?
Yeah. So we were talking. I saw you, Dr. Saunders, on Dave Asprey's. Well, you were on one of his guests,
Right.
one of those fireside chats at one of his conferences. And so it elicits, more questions about longevity and the use of hyperbaric oxygen in longevity. And particularly, I'd love to ask you about, the research and what you've seen in women's brain health. I
Yeah.
do a lot of integrative health coaching with women primarily, and we're always having these conversations of course, how to heal our bodies, but also how to preserve our bodies, right? How to continue to maintain that vital aspect of who we are as we age. So I know that this is an important component, but I'd love to hear from you and the research what you found.
Sure. So I think I want to start that with one of the more contemporary theories of aging is what's called the informational loss theory of aging. And what that means is, every cell in your body has the instructions to be any other cell in your body, right? Because you started as, right, two cells that became one, and then that
Right.
divided, you know, a lot of times.
A lot.
Let's just say.
Yes.
And they continue to divide and replicate regularly. So the DNA, which are the instructions, every cell has every bit of DNA in it, but somehow a liver cell knows how to be a liver. So only
Right.
liver cell information is expressed, even though it has information to be a skin cell or a brain cell, right?
Right.
A skin cell knows how to be a skin cell and express only that little bit of information, even though liver cell information and kidney cell information are in there.
Sure.
And why that's important is when cells are young and behaving properly, and what we strive for when we have conversations about longevity and anti-aging, those cells are incredibly they have a really strong power to pull the information that they're supposed to get, but more importantly, suppress all of the other information. And so
Mm.
when we have conversations about epigenetics, which are
Yep.
sort of the signaling around our DNA that allows the expression or suppression of information, the majority of the job of the epigenome is suppression.
Hmm.
And
Good
it's when
point.
you lose your ability to suppress that information that some aberrant activity starts to occur inside that cell. All of a sudden, it starts to take on some properties or some functions of other cell types that it's not designed to do. And that's where
Mm.
a lot of, accelerated aging and, cellular senescent issues start to
Right.
accumulate inside someone's body.
Right.
So I bring that up to say, if that is a good, assumption of why, because if we want to impact something, we have to first understand why it's happened,
That's
right?
right.
Oh, you're talking her language. The why behind the
The
what.
why behind the
Exactly.
what is what I'm
So,
always saying.
I'm always right. So I love that, and I'm like, that's it. I'm always just, if this happens, why did that happen, right?
Hmm.
Why?
If we don't answer that, then we have nowhere else to really go.
Exactly.
And
Yep.
so I'm always digging into that sort of thought. And so, well, it turns out that uh, the epigenome, your DNA, the whole cell cycle, the replication process, the mitosis, the meiosis, all of these cellular processes also, like the nervous system, require a tremendous amount of oxygen.
Mm.
Hmm.
And so as a cell starts to lose some of its function, as it starts to just not be pulling oxygen, or there's inflammation, which a lot of people suffer from, or
Yes.
mitochondrial dysfunction, which a lot of people
Right.
suffer from,
Hmm.
or toxicity, which a lot of people suffer from,
Hmm.
these become barriers of oxygen delivery.
Right.
Hmm.
And so we start to become mildly hypoxic, not enough that you can't survive. You certainly can survive, but enough that you're just not getting the optimum range of what you need for all the functions and things like DNA repair or epigenetic repair or epigenetic silencing. These are incredibly energy expensive systems that we have.
Yeah.
And so right away, just by using even mild pressures at air levels, like 1.3 air only, we start to see upregulation of cognitive function. We start to see upregulation of stem cells getting mobilized and growth factors. So, even at the most mildest spectrum of hyperbaric, we start to see incredible changes that are very meaningful for people looking for that sort of longevity component.
Wow.
But even beyond that, and to your point with, let's say, women's brains, or there's just a whole conversation around your body's ability to communicate through neurotransmitters and your body's ability to communicate through hormones, allowing the rest of the system and all the other tissue types and other systems to communicate with one another to understand, here's this stimulus that's coming into my body, here's the response that we would like to generate as to that stimuli, and then here's the actual release of that response. So much of that coordination is done A, through the nervous system, which we've talked about, and B, also through the endocrine system, through hormones. And so again, incredibly energy expensive systems, and our ability to do that, do it quickly and do it accurately and appropriately, relies on how much cellular energy we have to produce these different molecules, these different chemicals inside of our body, so that we can communicate effectively. And so, I wouldn't say that hyperbaric increases serotonin or increases dopamine or decreases, or what I would say is it just allows, again, the body to have the ingredient that it would normally have had, that it had enough of, 5 years ago, 10 years ago, 20 years ago, but for a number of different reasons is starting to lose its ability to extract it. And now we're just boosting that system up again and allowing, and as a result, we see people, if a certain neurotransmitter is low, we do start to see that it rises. If we see a certain hormone that's low, we do start to see that it's rising, but not because it's the ingredient for estrogen, right? Or that it's the ingredient for progesterone, but to take cholesterol and vitamin D, turn it into pregnenolone and then turn it into, let's say DHEA and then estrogen, like all of those pathways require energy. And, as other conversations around NAD or, other energy precursors, these are all things that, for a number of reasons, and people say as we age, which partially might be true, but I believe that it's because as we age, we're not taking great care of ourselves. And
That's
so I
right.
think we're aging faster than we were designed. I think we're breaking down faster than we were designed. And if you play an active role, which I know that you guys stress in your office, like if you play an active role in your healthcare, you should expect that 5 years goes by and you are healthier, more vibrant, with a higher quality of life. You should not expect that 5 years go by and that's another 5-year loss of quality, 5-year loss of activity, 5-year loss of cognition. That's what people see because they're generally very passive, unfortunately, in their health.
That's right.
But with an active role, we should see the total opposite of that. And I would say I haven't met someone yet who, even when I was practicing, full-time myself, I never met a patient that I said, "Oh, you're the healthiest you could possibly be. There's no improvement for you." Like that person, I haven't met them yet. And so I know there's so much that we could all offer our patient base to really improve their health and longevity over years and years to come.
I mean, these are some of the foundations we talk about, right? We talk about sleep, we talk about diet and the ultra processed foods. We talk about movement. We talk about all these factors, which are actually just foundational. And if you're working on those, and then my wife has brought out some podcasts on agency, taking an active role on what you have agency around your health. That's kind of what you're saying. It fits perfectly with that. I love that. Did that get more to what you were asking, May?
Yeah, no, I mean, I love what you kept saying. I wrote it down. All these certain systems are energy expensive. They're expensive, right? They're expensive to the body. And I love that because we don't think in those terms. And, when people eat ultra processed foods or they smoke or they, whatever habits they have, right, that they want to kick, what they don't realize, maybe, logically at first they think, okay, well, this is not really healthy for me. But what they don't realize is how much energy they're robbing of all of these systems that may not be immediate. But to
Right.
your point, like 5 years down the line, why does this person look like 20 years older? Right?
Right.
Because those systems have not been supported. And now they're not doing their job to the fullest potential. So yeah, I
Exactly.
think that's really good. You mentioned a lot about cells earlier. Where in the conversation, if you feel comfortable talking about this, where in the conversation does with hyperbaric, does stem cells, there's so much talk about stem cells and then another whole area about peptides, where does this kind of come into hyperbaric in the longevity conversation?
Yeah. So, first of all, we all need stem cells
Yep.
and we all have stem cells.
Yep.
um, and so there are stem cell therapies where we can, either harvest our own or get somebody else's or exosome, there's such a number of different therapies,
Sure.
and that world is growing rapidly as well. But it's not like you don't have your own.
Right.
And that's an important distinction. It's like people think, well, if I don't go get stem cells from, this office,
Right.
then I can't repair. Well, we have to, I think we should be going in a sequence of thought. And so, is it possible that your own stem cell mobilization system is also under functioning?
That's right.
In most cases, the answer to that is yes.
Mhm.
Also, I tore my shoulder a few years ago,
Mhm.
like felt like it was hanging by a thread.
Mm.
And I was like, Melissa, I'm getting surgery. Like, I'm getting surgery. I would go to no doctors and I would never have surgery. If you don't know me, like that's never going to happen. Right. But I was like, there's no freaking way. Like I can't live like this.
Yeah.
And Melissa's like, what would you say to a patient if they said that to you? And I was like, that's a good question. So I sat down, I wrote up a whole protocol and I was like, worst case, I mean, this is what I tell patients all the time. Worst case scenario is I'll go into the surgery, the best version of myself, which can only make the outcome better. And the worst case
Absolutely.
scenario is, or the best case scenario is, I don't even need the surgery if it all works out. So I wrote up this whole protocol. It included peptides, it included stem cells and exosomes, it included hyperbaric, right? But this was like major healing that needed to happen, right?
Mhm.
But I also did it in a framework where if this is torn, shredded, inflamed tissue damage, and you stick a bunch of stem cells in there, we get results with that. However, you just stuck a bunch of naive stem cells into an angry, inflamed, and dysfunctional joint. So
Mhm. Good
you'll
point.
get some result, but it's not going to be optimized at all. By doing hyperbaric, you are reducing inflammation, you're
Mhm.
stimulating tissue repair and regeneration. So there's already some sort of, inflammation control and tissue repair going on. And
Yep.
hyperbaric upregulates our own stem cell systems. At the lowest end, which is like 1.3 air only,
Right.
it upregulates stem cells somewhere between 2.5 to 3 times. And
Amazing.
at 2 atmospheres on 100% oxygen, it'll be somewhere closer to like 8 times. But
Mm.
Wow.
all of the pressures that we use in hyperbaric stimulate stem cell mobilization, right?
Mhm.
So if I could remove him inflammation, start a healing process, start the tissue repair, upregulate my own stem cells, and then put some stem cell exogenous stem cell, well now there's an environment that's more conducive for that healing to occur. So again, it's not a right or wrong in any stretch. To me, it's like, why and what is the goal, right? So
Yep.
like, why is this going on and what is the goal and how do we put the right steps in place for anybody who's now deciding to go on that journey? But
Yeah.
they work well, and this is true for so many other things that you guys do as well, but there's synergy,
Yes.
right?
That's right.
It's not an either or, it's a both and.
Yep.
Though sometimes it's a timing thing. Okay, both
Mhm.
and. However, a little bit of this and a little bit of this, and Mike, I was trained least invasive to most invasive, and so
Right.
what can I do? What's the minimum effective dose of anything that I can offer, and how do
Mhm.
I start low and build up over time? Because
Mhm.
can't hurt somebody. That's my first job, is to do no further damage, and my second job is to, build something that is going to move them in the direction that they're trying to move. And so we always do that sort of like at a step by step. And if we get to a point where they get to the result and we didn't go through the whole program, that's a win. That saved money, that saved time, that saved additional therapies. But if we do it responsibly, we can, we can navigate that, in a very safe and effective way.
Good.
Love that. Doc, one more thing, I know that we're going to be wrapping up here, but I also know you've written 4 books, as you said earlier. What would you say would be the best title if our listeners want to learn more about hyperbaric oxygen and its benefits? I know you've written countless papers and things, but where would you direct them to go? I know your YouTube channel is amazing. I follow you and I get educated regularly. I love learning from you there. So that's something that we can highlight. But what about one of your books for someone who wants to learn?
I think for like the general public, Oxygen Under Pressure is a easy read. It talks a little bit more about some of the kind of healthcare philosophy that we were just getting into a little bit as well.
Yeah.
And then what role hyperbaric plays in all of that. For a provider, last year we published a textbook on hyperbaric, The Art and Science of Hyperbaric Medicine. That was with Dr. Joe DeTore and I. And that's,
amazing.
That's a much heavier read. I love it, but you have to really love the details to get into that book. But in there, we talk a lot about the why, right? Is it I never want somebody treating somebody off label because Jason said so. Like,
sure.
We can't, that's not a defendable rationale. And so what we really try to do in the courses that we teach and what we try to do in that book, which mimics the course essentially, is what's the thought process, right? Is it appropriate to put this person in the chamber, and how do you know? And so we spend a lot of time on the science, on the mechanisms of action, understanding on the on-label side, how do we know why and what hyperbaric is doing? And then what's the justification and the way to think through how to apply those things off-label? And, I think that book does a great job of summarizing the course, though I think there's no replacement for that class. That's my opinion. But
of course.
YouTube channel also very, very good. Well done. Well said. Everything's very elegant. Hyperbaric oxygen available around the world for the most part, isn't it?
It is, and growing literally. Next month, I'm going to Sweden and Denmark to keep moving that around. November, I think we're going to Morocco for another big show.
Wow.
So,
Ooh, funny Morocco, November.
There you go. Yes.
But yeah, we're trying to move that needle for sure.
Amazing.
Well, people can get information about where they are, find out. And I know you have your offices also for practitioners who may want to get their own chamber and get more understanding. Where would they go for that?
So hbotusa.com is, our main website. We don't sell anything there directly, but it's a lot of information about, how is it a good fit? Some frequently asked questions. Who's it good for? What's some of the science? And as you mentioned earlier, I think the YouTube channel is a great place for people just to learn more. No cost. Just sit down and take it in nice and easy. And then the hbotcourse.com is the website that hosts all of our courses and like business consulting materials, things like that.
Amazing.
Well, we appreciate your time so much.
Thank you. That was great.
With the kids and your wife and everything, we just appreciate your time and your knowledge and your training and teaching. So we'll keep pressuring up oxygen, the most essential ingredient to that energy production in our body and our brain. Thanks so much, Doc.
Thank you.
All right. Thanks, everyone. Have a good day.